My name is Daria. I'm a policy analyst at the Center for Progressive Reform and your moderator today. In addition to being a CPR member scholar, Dan Farber, who's with us today, is the Shosato Professor of Law and the Faculty Director of the Center for Law, Energy, and the Environment at the University of California, Berkeley. He serves on the editorial board of Foundation Press and is a member of the American Academy of Arts and Sciences and a life member of the American Law Institute. From 1981 to 2002, he taught at the University of Minnesota Law Faculty, where he was the McKnight Presidential Professor of Public Law. He's also been a visiting professor at the Stanford Law School, Harvard Law School, and the University of Chicago Law School. His 20 books include leading case books on constitutional law and environmental law. Next, we have Monica Schock-Spana. She's a medical anthropologist and serves as a senior scholar with the Johns Hopkins Center for Health Security and senior scientist in the Department of Environmental Health and Engineering at the Johns Hopkins School of Public Health. She also holds faculty positions at the Department of Anthropology at Texas State University and the National Consortium for the Study of Terrorism and Responses to Terrorism. Prior to joining Hopkins, Dr. Schock-Spana worked at the UPMC Center for Health Security. She received her PhD in cultural anthropology from Johns Hopkins and a bachelor's in arts from Bryn Mawr College. Her areas of expertise include community resilience to disaster, public engagement and policymaking, crisis and risk communication, and public health emergency preparedness. And finally, we've got Dr. Aaron Bernstein. He's the director of the Center for Climate, Health, and the Global Environment at the Harvard T.H. Chan School of Public Health, also known as Harvard C-Change. He's also a pediatrician at Boston Children's Hospital and an assistant professor of pediatrics at Harvard Medical School. He serves on the American Academy of Pediatrics Council on Environmental Health Executive Committee, is chair of the board of directors at the U.S. Green Building Council, and is on the board of advisors at Parents Magazine as an environmental health specialist. He completed his bachelor's degree at Stanford, his medical degree at the University of Chicago, and a Master of Public Health at Harvard University. He's a recipient of Stanford University's Firestone Medal for Research and a Harvard University Zuckerman Fellowship. His areas of expertise include the impacts of the climate crisis on children's health and advancing solutions to address its causes to improve the health and well-being of children around the world. All right, so with that, we are going to dive into a moderated discussion with the speakers, and then as I mentioned earlier, we'll have an opportunity for attendees to submit their questions in the Q&A at the end. All right, so to start, can each of you share a little bit about how you're approaching the ongoing COVID pandemic from the lens of your discipline? Dan, why don't you start us off, then we'll go over to Monica and then Ari.
Sure. So I've been interested in disaster law for quite a long time, ever since Hurricane Katrina, and that's one of the related areas that has led me into thinking about COVID-19. There are a lot of legal issues almost every day. For example, issues raised by Trump's executive order yesterday to keep meat plants operating. And so there's really a lot of fodder there for legal analysis.
As Daria mentioned, I'm a cultural anthropologist, and for the last 20 years, I have worked in the field of public health emergency management. And I'm interested in the active role that community members themselves can take in the management of disasters and epidemics. When I got into this field 20 years ago, what was referred to as the public was considered a problem to be managed. We have evolved over the last 20 years in terms of policy and practice in public health emergency preparedness to consider the larger community as the most critical asset in preparing for, responding to, and recovering from extreme events. So I have a bias in terms of a grassroots up perspective on these types of events.
I get to wear two hats in how I deal with this problem. So one is as a pediatrician, And there's a whole series of new challenges we face in trying to provide care in the context of the pandemic for children, whether that relates to, how we're going to deal with the testing challenges and the protection challenges that occur with inpatient care, or the reality that children aren't showing up for vaccines, and trying to figure out innovative ways to keep children healthy when their parents may be afraid of showing up at a clinic. The other side of my life, we're really trying to understand, now that the economy has been slowed down by the virus, where are the opportunities to get win-wins as huge amounts of money are spent to kickstart the economy? Can we leverage this huge taxpayer-backed investment in our country to put us on a healthier path when it comes to transportation, energy systems, food systems, rather than spill money into places that are going to keep us on a path that's going to make us dependent on fossil fuels, which we could have done previously, but if there's an opportunity here, we should seize it.
Great, thank you all. So for our next question, this one's for Monica. What are some of the disparate impacts to vulnerable populations from COVID-19?
Thanks, Daria, for that opening question. And I think your introduction to the panel was very apt. COVID-19 is not an equal opportunity type of experience. So it has had disproportionate impacts on some groups over others. And when I was sitting down to start enumerating those vulnerabilities and explanations for those vulnerabilities, the list sadly was getting fairly long. So certainly communities of color are adversely affected by COVID-19. We're starting to see some not surprising, though still shocking statistics. We see that, for instance, African Americans make up 45% of the total population in Washington, D.C., and yet 59% of the deaths attributable to COVID-19 actually are tied to the African American community. And in Louisiana, the statistics are even more unsettling, where African Americans make up about a third of the total state population. 70% of COVID-19 deaths are suffered in the African American community. So, and those are early statistics. So why is that differential impact happening among communities of color? Well, in terms of the social determinants, we have people of color more likely to live in locations and housing situations that put them at increased risk, whether they're in high density urban centers or living in crowded living conditions, multifamily dwellings, or intergenerational arrangements in a single home. We have high rates of pre-existing conditions such as heart disease, asthma, and diabetes, and those pre-existing conditions actually contribute to more severe disease effects with the novel coronavirus. And then there's, of course, impediments to care in the concrete form of being uninsured at a higher rates. Now that's just the disease aspects. Of course, you know, COVID-19, the pandemic, is also an economic disaster that is not experienced in an even fashion. So communities of color are facing increased financial risks to certain circumstances. And so social distancing, or physical distancing, which is what I prefer to call it, has led to cutbacks in terms of hours and operations for a number of businesses, some of which have had to close altogether. And in the service sectors, in which Blacks and Hispanics make about a quarter of, comprise a quarter of the numbers, we see that there's an increased risk for job loss or loss of income on the one hand, but for these essential workers who have to maintain their jobs in order to keep the income into their households, they're at a higher risk for exposure. So now that is just the effects for communities of culture, communities of color. And I can go into further details about Native Americans, senior citizens, the homeless, migrant and seasonal farm workers, and rural Americans, which I'm happy to discuss as well with some statistics and some descriptions. But I do also want to share the dias with my other panelists. So I'll stop there, Daria.
Yeah, and if folks have questions about that as well, we can have them ask that at the end. Dan and Ari, do you have anything to add to Monica's points?
I think she covered the waterfront there extremely well.
All right, great. So our next question, Dan, this one's for you. In recent publications, like the one pictured here from CPR's blog, you've discussed the Stafford Act and other federal powers that the president can invoke to better respond to COVID. Can you briefly describe what those are and how they could be used to protect vulnerable communities?
Sure. So the Stafford Act, I guess that's not exactly a household term, but that's anytime you see FEMA, basically the Stafford Act is likely to be involved. It's the law that allows the president to declare emergencies and also major disasters. And doing that gets FEMA involved, which in many circumstances allows them to help coordinate federal efforts, a bit less so in this situation because the White House has taken that over. But it also unlocks some important funding sources for things like grants, crisis counseling, community disaster loans, food coupons, and so on. The president has declared major disasters in every state, but my understanding is that not very much funding has been allocated as a result. There's also the National Emergencies Act, which Trump has also used to declare a national emergency. That law unlocks presidential powers in emergencies under a variety of other laws. So for example, the Defense Production Act, which dates from the Korean War, can be used for things like requiring and coordinating production of ventilators and other kinds of medical equipment. The administration has only sporadically used that authority, but yesterday, as I mentioned before, he did jump right in to make sure that we continue getting our meat available. And there are, I think, another 200 federal laws where the president has emergency powers. So many of them are just not relevant here, but there are a variety of others that could be used. One thing I also wanted to mention is that a number of those laws could conceivably be used in the climate change situation as well, if a president were to declare climate change to be an emergency. And then finally, there are a variety of powers under the public health laws, but I think my fellow panelists can probably address those better than I can. I know a little bit about those, but I'm sure that they have more expertise than I do.
Monica or Ari, do you want to speak to that?
Well, I'm not a public health law expert, but I'm certainly subject to the consequences of decisions around public health law. And I think one of the things I've noticed that's been particularly striking is how the laws that exist under, the situations that we face, which is an epidemic, were designed to give powers to particularly heads of states to enforce quarantines, and that those are longstanding and upheld in legal reviews time after time, and people feel that their rights are being infringed upon, and they are. And this is a classic example of trying to, act in the benefits of the many. And the challenge becomes the political pressures that are placed on politicians in the face of science that would tell them to do otherwise. But we see every day families, and understandably so, that are wondering why all this seemingly self-inflicted pain and suffering is necessary, because after all, I don't, seeing the reality of the epidemic in certain communities can be hard for some people. I've noted that there have been healthcare workers who have, in places where protests emerged, stood out in the middle of the protests, sort of speaking to the protesters, essentially saying, "You're making our lives harder. You're going to force us to work more shifts. We're not going to have the resources to care for you with reckless behavior that's being engaged in here by not engaging," and I would agree with Monica, physical distancing. So I think the lack of understanding of the laws as written has in some ways compounded the frustrations that are understandable. And we're seeing that play out on TV.
All right, so new research just came out of the Harvard School of Public Health connecting PM 2.5 or fine particulate matter levels to an elevated mortality rate from COVID. Ari, as a climate and health expert, could you share some of the ways that pollution and environmental degradation can increase community vulnerability to COVID?
Well, sure. So the study you reference is done by some colleagues. I was not directly involved in the research at the Harvard Chance School, including Zhao Yu and Rachel Nethery, and Francesca Dominici was the senior author. And what they showed in that paper is that people's long-term exposure to air pollution, so over more than a decade and where they live, is really potentially affecting the risk of dying from COVID, accounting for other things that might affect one's likelihood of dying, like your socioeconomic status, whether you have pre-existing medical conditions, the density of the population where you live, because obviously if you're living in a place where there are more people densely living together, your risk may be higher. And frankly, that's not terribly surprising, because we have many other research studies that have shown exactly the same thing, and including in coronavirus, in SARS, and as well with influenza and other viral infections. So this is not particularly groundbreaking, save for the reality of the effect, which was for a very small change in air pollution levels, there was a very big difference in mortality rates. The true measure of science is not in the, I would say these, I'm at the institution, I know these folks, I think they're enormously capable. They have an enormous track record in this particular area, and I would put great credence into what the research they've done, but the ultimate test is reproducibility. And I know of other folks who are looking at this same question from different angles. But the more we learn about pollution, and even in the United States, where we've done a tremendous amount to clean up the air in general is cleaner for almost everybody than it was 30 or 40 years ago. And it's still worthwhile from a health and economic standpoint to clean our air. And that's because we've learned that it isn't just people dying too soon from air pollution, it's pregnancy outcomes that go bad. It's children's brains that are harmed. It's lung cancers that develop. And so the more we realize how harmful this pollution is to ourselves, the justification for reducing it grows stronger. The other point that is critical in this context, and especially in this particular webinar, is that as we have improved the pollution in the United States, we've outsourced it to poor people in other parts of the world. And the problem of exported exposure is one we haven't tackled nearly well enough, but the reality is there are, somewhere between 6 and 10 million people dying every year from air pollution, and the overwhelming majority of people who are dying from outdoor air pollution is from burning fossil fuels. And that is happening to produce goods that are in many cases sent to us. So I think one of the things we need to recognize is that even as we improve quality here, environmental quality here, and we still have room to grow, we need to recognize that, and COVID couldn't make this clearer, that the pollution happening in China may be contributing to the spread of the disease there, which is a problem not just for them, it's a problem for us. So we need to start having mechanisms to really recognize that the health of us, each of us, is not just a function of whether we eat well and exercise and do things independently to protect our health, although it certainly is. Our health really is depends upon the folks who are most vulnerable in the communities we live in and around the world.
Mm-hmm. And as a follow-up, how does climate change play a role in infectious disease outbreaks?
Well, there's two sides to that. You know, we have evidence already that climate change is causing diseases to emerge, whether that's diseases in water like Vibrios in the United States, or waterborne diseases, or even insect-borne diseases like Lyme disease and potentially malaria. We know that the warming that's happening is pushing animals to move places they haven't been before, and that creates contact between people and animals that is new. There's also some ties, though, that are critical to understand in the solution space, which is that, you know, the reason we're seeing these emerging infectious diseases, which are happening at an increasing pace over time, is very clearly because of how humans are doing business with the biosphere. Through deforestation, through harvesting wildlife, through transforming the climate. And that means if we do things like protect forests, we will prevent climate change, of course, because deforestation constitutes 10% or so at least of global carbon emissions, and will go a long way to preventing pandemics. We'll also deal with air pollution because, you know, as I mentioned, so many people are dying from fossil fuel-based air pollution. We'll prevent those deaths. That'll happen as soon as we stop burning the fossil fuels, and we'll deal with 70% of our carbon problem. And so there are ways that these problems connect. And the good news is that we now have just one rationale after another to find ways to transition our economies to clean and renewable energy systems that hopefully will accelerate progress.
Yep, thank you. So recently we've seen the Environmental Protection Agency set the stage for weakening power plant mercury and air toxic standards. Dan, is the agency just justified in this determination, and what are the implications of this rollback on communities located near these facilities?
So this is a really complicated legal situation, and I've really struggled with how to get this down to just a few sentences. Basically, the EPA is trying out a strategy it wants to use to weaken a lot of different regulations, including climate change regulations. And what they're adopting is kind of a one pollutant at a time strategy. Reducing mercury and toxics from power plants also reduces the particulate pollution that we just heard about with the Harvard study. And if you take that into account, that's a big health effect. But EPA now says, no, we can only consider the direct effect of eliminating the mercury. We can't consider the fact that we're also would be saving thousands of lives because of the reduction in particulates. And so it's kind of a divide and conquer. When they look at climate change, they only want to look at the direct effects of reducing CO2, which are certainly substantial, but they want to rule out looking at all the other effects of reducing air pollution that come right along with that. No, I don't think that's justified. I think, and I think if you talk to people from a whole range of fields, if you talk to public health people, if you talk to economists, everybody agrees that this kind of tunnel vision makes no sense. Yes, obviously it's going to affect communities located near these facilities, both because they are more likely to be exposed to the mercury and also because they are more likely to be exposed to those particulates. And often those are going to be low income communities and communities of color because those are not generally considered desirable locations. So the people who experience them are those who are kind of on the bottom of the heap. So I hope that lays it out for you.
Do other folks, Ari, I know you were quoted on this as well.
Well, I think, so I would agree with Dan's assessment. Essentially, this is an attempt to essentially ignore benefits that are quite substantial, and the legal underpinnings of that, Dan is certainly more qualified to address than I am. But, you know, even with the tunnel vision, as Dan put it, the EPA's assessment doesn't hold water. We've done analysis on this showing that the EPA, for instance, in their decision to, you know, essentially withdraw the MATS rule, claimed that the benefits of mercury, you know, would be in the amount of about $10 million or less, when the scientific evidence is that it's in the billions of dollars a year. So I don't know where they did their math, but it is completely beyond what the scientific literature, they did cite studies that are almost a decade old. There's been several studies since showing the damages. Again, this is just another instance where, you know, we only know what research has been done, and the research was done showing that, you know, it's happening. And let me be clear about what's at stake here. In anticipation of the MATS rule, power companies started taking actions to reduce mercury emissions. So even before the rule was actually finalized, there were substantial reductions in mercury that were observed. And that, by the best available science, reduced the number of babies born into the world in the United States by half. So before the MATS rule, there were somewhere on the order of 200 to 400,000 children who had blood mercury levels at birth that exceeded the EPA threshold for brain damage. So we cut that in half. And the costs of the brain damage have been estimated in the billions of dollars a year for those children alone over their lifespans. So now we're looking at, instead of further reductions, going back to where we were previously. And this, by the way, is in utero exposure. So this is women who are primarily eating fish that has mercury in it, that's polluted by mercury from burning coal. They eat the fish, it goes to their bloodstream and damages the fetus's brain before the child is even born. So even on the mercury basis, and I would argue doing that, you know, makes no sense. If you get stabbed in your chest with a sword and you're bleeding out and your lungs punctured, do you want your doctor to just stem the bleeding and leave your lung you know, the logic here on its surface is really bizarre. And it really, frankly, makes me wonder who these folks are trying to protect in this equation, because it's certainly not my children or anyone's children. And so we have to ask that question: is whose interest is the EPA working for? The EPA, as I understand it, is an agency that is set out to protect the environment and people's health.
Right, thank you. So one of the major determinants of our ability to respond to COVID is the capacity of our healthcare system. Ari, as a pediatrician, could you speak to what gaps this pandemic has revealed about the U.S. healthcare system and how we can build resilience to future outbreaks?
Well, you know, what things like pandemics, or for that matter, climate change do is they lay bare the weaknesses in our societies, right? So the inequities are blown up in our face. And that's as true with what Monica was talking about before in terms of the harms in African Americans. And I should have mentioned, you know, we've known, and Monica, you know, made this clear, I think, but just to emphasize it, it is not news that African Americans in particular and Latinx community are disproportionately exposed to the air pollution that was shown to be potentially causing more deaths from COVID. And so now we're left to wonder, are, at least in part, these mortality effects, are they in fact the long tail of redlining, for example, right? I mean, are we really seeing this effect of historical injustice now manifesting, or the fact that Marion County in Ohio has the highest incidence rate now of COVID in the country because of an outbreak in a prison? Well, who was incarcerated in the United States historically, and what is the, you know, the dimensions of that history now playing out in COVID? So in the context of healthcare, look, we have health disparities in this country that have been very stubborn to interventions, because it turns out that people like me doing our job as doctors, we don't have a lot of ability to deal with the social determinants of health that Monica was talking about. We're doing more for sure, but what's driving these health inequalities are the social determinants of health, structural racism, and things of the like. And so the healthcare system is really equipped to deal with problems after they happen. And so we are not prepared for this kind of thing. And the fact that it amplifies these injustices comes to our front door. The other side of it, of course, is there's this huge challenge with people who are not seeking care because they're afraid to come in. And our health system is not equipped to deal with that problem either. But ultimately, you know, we spend $2.6 trillion taking care of people after they get sick in this country. And a large share, and depending on who you ask, somewhere between 20% or more than half of that is readily preventable. And so could we figure out a way to take some of that $2.6 trillion that we're spending after people get sick and keep people healthier? Because as we know, you know, air pollution aside, one of the reasons that people are dying, actually the major reason, aside from age, that people are dying from this disease is pre-existing health conditions. And the reality is that because our population at baseline has these health inequities, which, as I alluded to, drive the spread of the disease and make everyone more vulnerable, that the fact that we have like a third of adults who are obese, we have potential of having many percentages of the population with type 2 diabetes. By the way, type 2 diabetes and high blood pressure and heart disease, all packaged with obesity and also with air pollution. If we actually tackled those problems, we would save huge amounts of healthcare costs. We would not be as at risk when a pandemic like COVID goes around. And here's the kicker, we would be dealing with climate change. Because of course, we know that the drivers of things like obesity and heart disease and so forth are unhealthy diets that rely heavily on red meat and processed meat, lack of access to public transportation and people sitting in cars all day. And so again, the beauty of the situation is that we have now this coincidence of reasons to focus on climate solutions as pandemic solutions, and frankly, as health solutions that we should probably be doing anyway, because at some point it doesn't matter. You know, we spend so much time in this country talking about who's going to pay for healthcare. You know, is it going to be a government insurer, private? And we have that conversation endlessly, but the bottom line is we're spending 18% of GDP and $2.6 trillion. At some point, we're just too sick, and it doesn't matter who pays. And so we have reason in and of itself to do these things. And the great news is that all those things I mentioned are going to help solve other huge problems that we need to deal with anyway.
Yep, thank you. So Monica, you've researched and developed self-assessment tools for community resilience to disasters. Could you share more about your work on this, as well as how tools like this might inform the ongoing debate around reopening the economy?
Well, in a wonderful observation is that we seem to be in the United States shifting from a response mindset, let's just deal with disasters as they happen, to a focus more on resilience, which is the ability to withstand disasters in the first place, and then learn from them and take steps to mitigate future consequences. The question is, community resilience is an elusive type of goal unless you can operationalize it or concretize it for people. And so I was involved with a group that developed the Copewell measurement system for assessing community resilience. And what's helpful about measurement is that it concretizes this intangible goal of resilience. It gives people a language with which to undertake cross-sector conversations and the type of planning, participatory planning that needs to happen around strengthening community resilience. And so Copewell included a conceptual framework that approached community resilience to disasters as occurring at the intersection of social systems, our built environment, and natural systems. And because typically community resilience measurement systems have either prioritized the built environment or the social environment, and sadly, very rarely have prioritized the natural environment. And so what this resilience concept does is tackle all three of those. As it relates to the reopening the economy discussion, I think what was essential to the Copewell model of community resilience was that the economy was one part of comprehensive community functioning. It wasn't the dominant part, it was one of many parts that included housing, health and well-being, transportation, communication, and so on, and saw the interconnections of all these sectors. So I think in terms of the reopening the economy conversation that's currently dominating public discourse, it is to pit, I think artificially, public health ends and economic ends is to pit them against one another when they're actually integral. So I think what we need with regard to community resilience is, and what the Copewell model was trying to do, was to bring together people of diverse perspectives from diverse sectors and engage them in a collaborative planning process by which they would set priorities as a community. And it sort of flies in the face of one particular metric being used with which to measure the well-being of a community. In this case, the current discussion about the economy above all things, or for others, the public health above all things, when those need to be considered simultaneously by a group brought together to weigh trade-offs and set priorities.
Thank you. So this next one's for you as well, Monica. As a health security expert, can you speak to how states and locales soon to be affected by fire and hurricane season can best prepare for potential evacuations and disaster recovery if social distancing drags on through the year?
Yeah.
Or physical.
Yeah. As if it wasn't bad enough to have a pandemic, you can have multiple hazards happening or coming into play at the same time. So with regard to evacuations, potentially in wildfire season or hurricane season, I think what's important now is emergency planning, engage in the what if scenario, so that tabletops are among decision makers are being conducted that speak to multiple hazards. In the case of physical distancing, the type of planning that needs to happen is that local jurisdictions may need to plan for more shelters that would lower the density of people who seek refuge there in order to engage in greater physical distancing. I think it's important to revisit our preparedness messages to individuals, in addition to having family reunification plans and other types of preparedness activities such as stockpiled essentials. If you're asked to stay in place, is that they may need to stock up on cloth masks and have a stockpile of cloth masks if they cannot be washed, for instance, if individuals go to shelters and are away from home for a while. So I think planning in advance through what if scenarios and tabletops, providing for more shelters, planning for more shelters to allow physical distancing, and revising our preparedness messages to individuals and families about how to be safe in terms of multiple hazards is going to be important.
Thank you. So while greenhouse gas emissions dropped in many countries following stay-at-home orders, for example, shown in this image here from China, the Center for Research on Energy and Clean Air found that coal burning was back to normal in China by the end of March. Dan, from a policy-making perspective, are there ways to build climate resilience into our response to COVID so we don't return to business as usual?
Yeah, I think we really need to be thinking about the reopening process and what kind of economy we want to see as we're reopening. How can we leverage that to make progress on some of the other issues like climate change that are facing us? And I guess if I were Joe Biden, I'd say, folks, it isn't complicated. So it's simple. So really, there are a lot of kind of obvious things that what we need to do. We need to put recovery money into things like renewable energy and incentivizing electric vehicles, trying to build out that network. We need to get people jobs doing energy efficiency work. We need to be thinking about other parts of our infrastructure are really kind of obsolete, or partially obsolete, and aging infrastructure for things like the transmission system, for things like water quality, drinking water. And we need to undo all these regulatory rollbacks that are just making our health worse and making us more vulnerable to things like coronavirus. And we also need to not be pumping more money into the fossil fuel industry to prop up that industry at a time when we need to be phasing it out.
Thanks. So Elizabeth Sawin of Climate Interactive remarked that both the pandemic and the climate crisis are problems of exponential growth against a limited capacity to cope. Unfortunately, however, the global response to COVID is very different from that of climate change. Ari, why is this the case? And what lessons can be drawn from our response to COVID to yield swift collective action on climate change?
So that question's getting asked a lot these days, and I think what underpins it is the sense that we actually can do extraordinary things with our back when we feel our backs against the wall and we feel that our personal health is at stake, and particularly the health of people we care about. And in my mind, that means that I haven't done a good enough job at making clear that that is in fact the case with climate change. And we need to do a much better job, those of us who are particularly in the health space and interested in climate, of articulating that if we don't do climate actions, you're not going to be able to get health care. If we, as one example, that your individual health is in fact at risk, that the medicines you take are in fact not as safe as they used to be. That you might be more at risk of having, many diseases. But perhaps even more compelling than that, because in my mind, it's much easier to get people to get behind something that's going to make their health better, something they can look forward to, rather than trying to scare people away from something they don't want. And this gets very personal and very local, which is, the United States has seen air quality improvements for decades until the last 3 years. And because of those improvements, people are living longer and healthier lives. Children with asthma aren't suffering as much. Adults who have heart disease, diabetes, mental health disorders are doing better. And we can continue that progress. We can choose to continue that progress through transitioning off of fossil fuels, which is what's driving that problem. Or we can choose a path that's going to put us not only jeopardizing the climate, which of course is a major problem for our health, but it's going to jeopardize the health of everyone we know right now. And that in particular on the benefit side, this is an equalizer, right? I think Monica said, you know, pollution is not an equal opportunity killer. And when you deal with the sources of pollution in our communities, you're going to disproportionately benefit those who are most vulnerable. And so I think we can learn from the COVID experience that when health is on the table, when it's made personal, people are willing to do extraordinary things. And right now, the problem is that climate and fossil fuels are heavily politicized, and understandably so. And look what happened with COVID, which was that the politics, we've seen, in my view, an incredible incursion of science into political discourse. And that if you look at polls, Americans are now looking to science more than ever to help guide decisions. And so again, when people grasp that their health is at stake and that decisions that we make on an ongoing basis really matter to that, we have a much different conversation about climate action. So that to me is what we really need to learn from this experience in terms of moving forward and accelerating climate actions.
Thank you. So, so we have enough time for questions. I see a bunch coming in the Q&A. Our last question, I was hoping everyone could answer with one sentence or less. What do you believe is the key investment that must be made to protect vulnerable communities and build resilience, whether in response to COVID or the climate crisis? Why don't we start with Monica, Ari, and end with Dan?
Sure. I think we need to invest in more participatory planning so that vulnerable populations have a active voice in making decisions about strengthening the resilience of their community. We need to have all folks at the table, particularly those that are most disproportionately impacted by things like COVID-19 and climate change.
Thank you.
I think I'm up.
Yep.
Campaign finance reform.
Ditto.
I don't think I can keep my answer quite that short. Michael Lewis wrote a book just after the Trump administration came in called The Fifth Risk, which was about the institutional infrastructure that we have that thinks about how to protect vulnerable communities, how to protect societies from things like pandemics, climate change, a whole variety of other risks. We have been disinvesting in that infrastructure over a period of time, and it's gotten much worse under Trump. And I think we really need to rebuild and strengthen that infrastructure, because otherwise we're just going to find ourselves flat-footed the next time we are hit by another crisis.
Yeah. Thank you all so much. So we're going to dive into the Q&A section. I already see a few coming in. Folks, you can type your questions into the Q&A box. It should be at the bottom of your screen. And if possible, if it's directed to a specific person, please say so. All right, let's see. That one appears to be answered. Oh, okay, actually no. Brenda asked if they'd be interested in hearing more on Monica's take about disproportionate impacts to rural communities from COVID.
Sure. Rural communities in the United States have little to no public health infrastructure in comparison to major urban centers. So urban communities simply don't have the same type of capacity for disease surveillance, contact tracing, and epidemiological analysis. They just don't have it. And that is one place where urban centers are ahead of the game. Rural communities also are continuing to see or experience the loss of tertiary health systems en masse. rural communities typically have access to smaller, under-resourced community hospitals. And it's harder to get around. I mean, in rural communities, you have to be self-sufficient. You have to go farther to get to a pharmacy. You have to go farther to get to a hospital or a community health center. Go farther to get to a grocery store. So those are just a few. There aren't good numbers of intensive care units and mechanical ventilators in rural communities, given the limitations of the health sector. Yeah, so I'll stop there, but those are just a few vulnerabilities.
Thank you. So Dan, this one might be for you. Do those emergency powers that you were describing earlier allow the president to force workers to work at the affected industries?
I've been looking into that. It's not something I thought I would need to know about until just the last few days. There's a law under which the government can require workers to go back to work, for example, during a strike. But my understanding is it actually has an exception for health and safety issues. There's also the problem of whether that would be involuntary servitude. I think the risk is probably not so much a direct order to go back to work. It's the fact that if the employer reopens, people may lose unemployment benefits if they don't go back to work, and that may compel them. I think that's a real problem, and I'm not sure that there is any way of preventing that given the way the laws are written. And given the fact that right now a lot of these things are taking place in states that are tend to be pretty stingy about unemployment compensation in the first place. So I think the answer is no, you can't directly force people back to work, but you can make it economically impossible for them to refuse.
Thank you. And Jane Wen also added, rural communities also don't have access to broadband, so no telehealth, ordering online, or ability to end meetings like this, or public transportation. So thank you for adding that as well. All right, so another question from Stephanie. In addition to natural disasters like wildfires and hurricanes, there's also risk of chemical disasters and communities being injured or forced to evacuate due to those incidents. Can you speak to this, particularly in the context of EPA's emergency order suspending essentially all monitoring and enforcement of these polluting facilities during the pandemic? I'll let anyone take that.
I'll take a stab at least a part of it. So I think that question comes from experiences around Harvey and Katrina, where there was mass mobilization of toxic substances in those communities related to disasters. So too with, of course, the wildfires in California. The EPA, as I read it, the memo from EPA essentially in those instances requires folks to report that and essentially notify EPA and get back into compliance as soon as possible. I think, and this is not I don't have anything to say on the historical precedent here, but it strikes me that the same thing was done, in fact, when Harvey hit Houston, that these accidental dispersants were not, I don't think the EPA gave them leeway in the context of a natural disaster. The difference, of course, is that was after the fact sort of recognizing it rather than sort of saying up front, we're not going to pay attention. And so EPA historically, I can imagine that if you had a release of a toxic substance into a community that was unexpected, would require you to report that. And I think the idea here is that, in the best interpretation is that people, and I think there's a fair argument around, COVID may prevent workers from being available to do stuff, and it may be harder to comply with various rules. At least that's how it's couched as I've read it. And we just have to wonder, is that going to enable folks to be potentially more proactive in dealing with potential hazards, or potentially getting away with stuff that they would have not even thought about had they not been sort of informed that EPA is going to sort of not potentially enforce the rules as written.
Thank you. So we're at 2 o'clock, and I know Eastern at least, and we've got folks who have to end at 2. So I'm sorry we weren't able to get to all of the questions here. There's some fantastic questions, and if you really want an answer to that or looking for a resource, feel free to email us at info@progressivereform.org, and we can try to direct you to the right resource. Otherwise, thank you everyone for joining today. I know it's a tough time to get online. We really appreciate it, and for all your great questions. For folks who are interested in joining more CPR webinars, we have a webinar coming up on June 3rd, 6:30 to 7:30 Eastern, on healthy soils and just transition, which we're hosting in partnership with Fair Farms. We are also asked that if folks could please fill out the survey on your screen. It'll pop up after you exit the webinar. Otherwise, you're welcome to go to our website and follow us online for more content from CPR. Thank you again to our wonderful speakers, and hope you all have a great day. Bye.
Bye.
Bye-bye.